Hi there and welcome. My name is Dr. Wakas Kayani. I work with the World Parkinson's Program, and I welcome you to our latest initiative. I shall be spearheading a brand new online educational campaign in which we shall be bringing healthcare professionals from every spectrum of healthcare to come in and talk about special topics that are related to Parkinson's disease but are not always thought of when a patient is initially diagnosed with Parkinson's disease. It is our sincere hope that through this new initiative we are going to be able to further educate and bring awareness to special topics that are not always thought of when a patient is initially diagnosed with Parkinson's disease, yet are vitally important for their future well-being. Now, this being our introductory video, I would like to introduce the World Parkinson's Program. We are a Canadian-based global non-for-profit organization with the aim of improving the lives of those affected with Parkinson's disease both directly and indirectly. Our aim is to reach every individual that has been affected with Parkinson's disease, to educate them in their own language, to provide support services, as well as to advocate for them both at a local and global level. Those who fight Parkinson's with knowledge always find a solution. This is the central theme to our program. The World Parkinson's Program is the brainchild of Dr. A.Q. Rana, a Canadian-based neurologist, and through his efforts and like-minded individuals, this program now has chapters in many countries all across the world. Now, in our introductory video, we selected a topic that is rarely thought of when a patient is initially diagnosed with Parkinson's disease, yet can have a significant impact upon their lives, and that is oral and dental health care. To discuss this topic, we have brought together two world-renowned experts in the field of oral and dental health care. These individuals shall be discussing both from a general standpoint what a Parkinson's disease patient should discuss with their oral and dental hygienist and dentist, as well as two topics, namely drooling and the importance of electronic toothbrushes. Our first expert is Dr. Melanie Simmerbeck. Dr. Simmerbeck is a professor in the Department of Dental Public Health and Behavioral Science at the University of Missouri Kansas City School of Dentistry. She has been a full-time faculty member at UMKC, teaching dental and dental hygiene students since 2004. Dr. Simmerbeck is a health services and implementation science researcher with an interdisciplinary background in oral and craniofacial sciences and public affairs and administration. Prior to pursuing a career in education and research, she was a registered dental hygienist and delivered oral health care to patients diagnosed with a variety of healthcare needs, including Parkinson's disease. Her research and teaching interests are access to oral health care, oral health disparities, special patient care such as Parkinson's disease patients, and dental workforce models as well as quality assessment. She shall be going over fundamental general topics that every Parkinson's disease patient must discuss with their oral health expert.
A diagnosis of Parkinson's disease can be traumatic for both the patient and their family and friends. And after receiving this diagnosis, there are a number of items that the patient and his or her family must consider. One item that is easily overlooked is oral health care. Patients diagnosed with Parkinson's disease frequently experience problems with their oral health, such as dry mouth, drooling, burning mouth pain, and loss of taste. Factors such as medications, nutritional deficiencies, and inability to remove plaque can contribute to these problems. Patients may also experience difficulty swallowing. This can lead to choking, sudden uncontrollable coughing, and silent aspiration pneumonia. Patients and caregivers should discuss these potential problems with their dentist and dental hygienist because they may lead to inadequate home care and increased risk for developing dental caries or cavities, periodontal disease or gum disease, tooth mobility, and tooth loss. And ultimately, this can lead to decreased quality of life. Many patients diagnosed with Parkinson's disease have been taking levodopa for a number of years. It is important for patients and caregivers to be aware of how long they have been taking levodopa and report this information at their dental appointment. A long-term side effect of levodopa is involuntary movements, and involuntary movements can affect a patient's jaw and make it difficult for the oral health care provider to access the patient's mouth. Patients and caregivers should report what involuntary movements, if any, the patient is experiencing. And finally, patients diagnosed with Parkinson's disease are at high risk for developing dental caries. It is important for patients to proactively prevent developing dental caries. Some preventive measures that have been shown to be beneficial include dental prophylaxis every 3 months, having fluoride applied at the prophylaxis, having a prescription fluoride that has high concentration of fluoride in the toothpaste, and using a mechanical toothbrush to remove plaque at home.
And welcome back. Now our second expert is Dr. M.I. Rana, no relation to Dr. A.Q. Rana, and he shall be going over two topics that Dr. Simmerbeck briefly touched upon, and those are drooling and the importance of electronic toothbrushes. Dr. Rana graduated with his Doctor of Dental Medicine degree from Temple University School of Dentistry in Philadelphia, Pennsylvania. He holds both the National Dental Examining Board of Canada license and the Northeastern Regional Board of Dental Examiners license of the United States of America. Dr. Rana is proficient in all aspects of dental work, including root canal therapy, crown and bridge treatment, and implants, as well as working with special populations such as those with Parkinson's disease. A large portion of his time is spent performing cosmetic surgery. He is dedicated to the newest advancements and research in the field of dentistry and keeps up to date with the latest technologies as a standing member of the Toronto Implant Study Club and the Ontario Dental Association.
78% of patients with Parkinson's report increased drooling. Parkinson's slows down our muscle movements. Drooling in Parkinson's disease is due to decreased swallowing and flexed head posture rather than hypersecretion. Swallowing problems often causes pooling of saliva in the mouth area. Food remnants may be left behind in the mouth after eating. Stooping postures and difficulty with closing our lips properly leads to drooling, which can actually cause moist skin around your mouth, leading to skin breakdown. On the other hand, part of the treatment for drooling includes simply straightening up your posture. If excessive, then drooling can also be treated with medications or botulism toxin injections, which significantly reduces the saliva production. So you have to watch how much you give. However, this has the potential to lead to dental caries as well if you give excessive, and there's dryness in the mouth. Dry mouth is a big cause of dental decay. It is therefore very crucial to maintain the balance between drooling and the treatment of drooling. I would also recommend frequent dental visits for these patients as well. Well, Parkinson's can greatly affect the dexterity that is much needed for brushing. Brushing requires muscle-eye coordination, digital dexterity, and tongue, cheek, lip control. It is therefore recommended that these patients use electric toothbrushes. It's also advisable to get the more advanced models, since not only do they clean teeth, they also help in mild flossing due to their sonic actions. The high vibrations of these bristles will also remove a greater portion of the bacteria and plaque that builds up. The patient can then get away with just holding the toothbrush as opposed to actually performing the action themselves, thus reducing their dexterity requirements. It's also much easier for caregivers to provide this service to their patients as well.
And this concludes our introductory video. I want to thank Dr. Simmerbeck and Dr. Rana. We definitely plan on working with them in the future to bring you more informative sessions. Please stay tuned for our future videos, and please visit our website at www.pdprogram.org. Take care.